amazing panel with me today, so the conversation is going to be really enjoyable and insightful. Thank you to all of those who chose to spend this coming hour with us today to talk about mental health with the people who are building and shaping the innovation around it. It is our fourth session of the records, and also this time we are broadcasting live from BIOME Novartis here at Mapletree. As we are all aware, October 10 marked the Global Awareness Day on Mental Health, and especially in these pandemic times, it has taken and gained a much broader meaning and also penetration in everyday life. I'm sure that all of us at some point in this experience have felt some sort of mental fatigue, anxiety, depression, burnout. I would suggest to raise your hands if any of these is true, and please also the audience can do the same. Exactly. Yes, the panelists all confirm. Also, let me quote a bit of WHO numbers and data that indeed confirm this small experience of us. 5% of adults globally suffer from depression, and 1 billion people worldwide have a mental disorder. This, of course, translates into an increased burden of staying and being healthy. In this environment that it's already in distress and the pandemic has exacerbated, we are going to ask ourselves what the digital health ventures are doing to take on the challenge, what stakeholders as insurance companies are doing to evolve their policies and make mental health more accessible. And of course, what investors are expecting to see from the industry. These are only some of the questions that I'm going to explore and discuss today with my panelists, and I will start with John Lowe, CEO and co-founder of Thoughtful, Priyanka Jha, Healthcare Transformation Manager from AXA, Antoinette Patterson, CEO and founder of Safe Space, and the gentleman, Wai-Chiu Chik, CEO and Executive Director of Heritas Capital. Thank you all for being with me today, and please take a moment to introduce yourselves.
Hi, everyone. Thank you so much for joining us today for the records. My name is Joan Lowe, and I'm the founder and CEO of Thoughtful. We're a digital mental health company whose vision is to make access to end-to-end mental health care more affordable for people. So I'll pass this over to Priyanka.
Thank you. Hi, everyone. I am Priyanka. I am part of the strategic function called Value Proposition at AXA Singapore. And I am driving multiple initiatives, leveraging data and technology for our group health transformation. And
Sure. Hi, everyone. I'm Antoinette. I'm the co-founder and CEO of Safe Space. Safe Space is a B2B2C digital mental health care provider. We are really happy to share that we are one of the leading trusted digital mental health ecosystem partners in the region, and we do so by driving value and positive outcomes through social impact and innovation. Okay, pass it on.
Thank you. Hi, I'm Wai-Chiu. I'm from Heritas Capital. I'm not sure if the camera pans here. Yeah, as you can see in this distinguished panel of ladies, I'm the diversity rep. I sort of prepare drinks for my fellow panelists. So Heritas Capital invests in promising ventures. We are an impact investor. We look for profits and growth, as well as impact in our investments. So we are very supportive of mental health investments, especially. Thank you.
Thank you so much to all of you. Thank you, Wai-Chiu. It was a great positioning of yourself. Okay, I would like to kickstart the conversation, and the first thing I will ask the audience to do is to post into the chat area your answer to the question, what do you do to feel good? So Christian Theo, the head of BIOME, it's posting the question right now, so please collaborate. We are going to read some of your answers at the end of the conversation, when also the panelists are going to share their activities of what they do to feel good. Okay, thank you for that. Okay, let me just share a couple of insights from a research, of course, curated by Galen Growth's team, Dario, Sarah, and Caroline. If you are listening to us, hi. The report showcases that currently there are 501 active digital health ventures around the world. The majority of them, of course, is the US. I would like to bring quite a pop comment in this piece, as I don't know if you know Jane Fonda, you know, the famous Hollywood actress, and in a movie she says, "Oh my God, this is America. Everyone is taking pills." To showcase a bit the openness of the continent to such solutions. The majority, as I said, is located in the US, and the same applies also for the funding deployed for mental health solutions. Indeed, the research shows that only 12% of the $1.8 billion that has been deployed in digital health, in mental health, has been deployed outside the US. As a region, APAC, of course, lags behind. I would like to start, open the panel with Antoinette in this case. I know that you have already conducted a research on the structural problems on mental health on the region. Would you please share a bit your insights from that research?
Sure, thank you so much. So we've actually are very big on research at Safe Space. You know, data for us really drives the transformation and the innovation that we do. So we've done 2 research pieces in this space. One is really on multi-market landscape when it comes to mental health, and one, of course, on our own impact measurement analysis. So for this, let's just focus on Singapore. So there is definitely a gap in the treatment for the public sector. So there are five areas of gaps. Firstly is stigma, and of course, self-stigma. You know, there is a stigma when it comes to use. You know, they prefer to share it with their peers versus sharing it with counselors. When it comes to working adults, there is a stigma on whether, you know, will they be accepted at work? So there is definitely a lot of fear and a lot of stigma there. Affordability is the next point. You know, in terms of the MediSafe that's available for use in Singapore, actually a lot of it is not being utilized. And less than 1 in 3 people know about subsidized mental health care. So there's definitely a gap in knowledge and a gap in awareness on what is affordable in Singapore. There is also a lack of a centralized system. And there is proof that if we can organize all the information that's available, it will increase help-seeking behavior. You know, and it's seen from a government level all the way until the private sector level that there is no centralized system. You know, so a lot more can be done in this space. And there's also the 4th area, which is use. You know, use has been a target, especially with the recent news happening in Singapore, where for the use, there's actually not much dedicated mental resources for them to utilize, you know, and there definitely can be more in that space. So there's definitely multiple gaps in the public system level where more can be done, and we really reach out to different parts of the ecosystem to help us tackle that together.
Fantastic, thank you so much. It's let's say that putting together the data, the need for more solutions, also more accessibility to that, it's pretty clear, I would say. Let's change stakeholder. I'll give you mine. Joan, you have recently raised 1.1 million in a seed series. Which factors helped your pitching? How was your journey, first of all? And sorry, step back. Congratulations.
Here, it's done.
And yes, please tell us a bit about your pitching.
Yes, thank you. I think it is for any founder out there, if you're in the crowd, you will know how excited you will be to go back to building the business. So it's definitely something we're excited about. I've been told that this seed round is one of the largest in the region for digital mental health care. So we're very, very honored and blessed for the trust that we've had with all the stakeholders involved in Thoughtful's journey. I think for most of us here, as you know, mental health care is still a very nascent, it's a nascent ecosystem and it's a nascent investment play, both fronts. And so for Thoughtful, we've been on this journey and we've been building and working at the problem since before the pandemic. So it's not something that, we're jumping on the bandwagon. It was something we were already working on it and kind of getting off the blocks, right? I would say with a lot of investment theses, sometimes it's just about timing as well. I would say that the timing in mental health care or digital health is really now. If we had these conversations, say in 2018, or, not everyone is as forward-looking as Waichik here at Heritas, who invested in 2016, right? If those conversations were then, I would say it would have been very different. The pandemic has given tailwinds to digital healthcare and also mental health because it is a problem that we cannot ignore anymore. And it is a solution that everyone, regardless of whether you're a corporate, you're an individual, you're an adult, or you're a child, everyone has actually had a direct interaction with digital health at some point in their life. And so I think timing has been key. Before this, most of the investment thesis, I would say the first cycle of, kind of VC investing was very much focused on B2C plays, very much focused on e-commerce, logistics, payments, all of that. And you're seeing kind of that cycle come to fruition now with the slew of exits as well as the kind of unicorns that are popping up right now. And I think we're really at the beginning, at the precipice of the next cycle for venture investment. And I think, digital health, but particularly mental health, is at the very core of it. And I think, investors are recognizing this. They're taking their cues, obviously, from a very frothy market in the US. And it's definitely something that they know is needed. Now, timing aside, and that said, in terms of just that journey for Thoughtful itself, I think a lot more goes into that due diligence process than just timing, right? We're, I fully recognize that we are joined by also very esteemed peers in the space and in the ecosystem. And we're very happy to see that we have more players coming into the field because it's so needed. The gaps are so wide that no one startup can actually plug in those gaps. And I think for us, for Thoughtful specifically, and I'm going to put my old, investor hat on here, it's really boiling down to kind of the 5 Ps of investments, right? You talk about the philosophy, you talk about the people, you talk about the product, the performance, as well as, what was the last one? I forget. What why'd you? I forget the last one.
Go ahead.
Yeah. And so I think when it comes to the philosophy, for example, it is definitely, it's very obvious. I think Thoughtful was started from a very real place. I myself, we've been caregivers for the last 20 years to someone living with very severe mental illnesses till today. And so experiencing firsthand those kind of challenges in accessing seamless end-to-end care is something that wasn't plucked out of thin air. It wasn't a bandwagon we jumped on during the pandemic. It was something, we've known for 20 years. And so right now we're working very deeply in the solutioning. In terms of the people, I think for Thoughtful as well, we've built a pretty strong founding team. So, I myself, ex-JP Morgan, we've got people from Accenture, we've got people from, SF for the clinical team, and we've just made very key hires from Grab, as well as data scientists from Bioformis. And so there's a lot of things that are going into building that founding team. And then when it comes to, I think, the process, that was the other one. I would lump kind of process, product, as well as performance for time's sake. But process is very much about astuteness, right? focus on the problem and astuteness in kind of managing resources to execute. I think that's very important. And then for performance as well as the product itself, Thoughtful Chat is already in the market. It's a one-stop platform, both for users to kind of access end-to-end care, but also for professionals to provide end-to-end care on both sides of the platform. And I think, the kind of corporate clients that we've tenfold that since launching last year. It's been a very busy time. Not particularly great for mental health, I have to say. But the traction has been tremendous. And so, I think throughout that fundraising process, that's kind of the key things that came up.
That's amazing. I was about to say, you don't have to leave now, so we have other questions to cover. Now, jokes aside, thank you for sharing the experience, and I think there are a lot of learning also for other founders who are embarking on the same pitching journey and fundraising journey. So thank you for that. It was quite an honest sharing. Let's open the conversation with an investor indeed in the space. Waichu, Heritas Capital, it's one of the investors behind Hallmask, which is quite a disease management platform that tackles also mental health, and also quite a famous one, and one of the most successful in the area right now. Please tell us a bit about the rationale behind that investment, and why Heritas Capital is looking at mental health, was looking at mental health actually.
Yeah, can you hear me now? Okay, sorry about that. No. Yeah, so mental health is obviously a big area of concern. So in addition to other indications that we seek to tackle, like oncology, cardiovascular, so these are areas that affect us a lot. But as Antoinette mentioned just now, a lot of times mental health is underappreciated. People want to avoid the stigma, and a lot of people want to downplay the issues and problems that they face. So we believe, right, as an impact investor, sometimes we want to lean against the trends, the markets, right, and then show the way, right, and also put money where our mouth is and try to catalyze attention and investments to their issues, right? So that's how we think. So sometimes we don't do what mainstream investors do at that time, but we believe it's a very real concern. We all have our own personal journeys with friends, with parents, relatives who have gone through that very difficult journey, depression, anxieties, multiple sclerosis and things like that, right? So, and the way we look at the state of play, right? We are way behind, right? Some of the developed markets. So if we don't put in the capital and give some of our promising startups the head start, then who will solve our problems, right? So that's where we jump in and, we showed that faith. Now, obviously, we couldn't foresee the pandemic coming. And when the pandemic came, I think there's a whole shift of consciousness towards understanding mental health. And we begin to say things like, it is okay to be not okay, right? And before this, really, most people will not want to say you are not okay. But now, it's a very tangible, positive development that we can acknowledge that we are vulnerable, we are weak, we need help, right? And everyone will take their turn, right? Just like someday we might catch COVID, and there's nothing to be ashamed about. So from all the repeated lockdowns, the stabilization, whatever we call it, right? End of the day, I think we all need help here. And I think it's very good timing to step up further in terms of investment capital and other means of support. And that's why I'm so glad we are all here as an ecosystem. I think we have got payers like insurers, we've got startups, we've got investors, all trying to do the same thing to achieve the same outcome, where we have solutions for folks who need help. Yeah, so that's the reason and rationale for our investments into mental health. And I would just add, that, why digital health, right? Because ultimately this is part of a greater kind of behavioral health challenge we are trying to solve. And the truth is more and more people are using their mobile phones, right? So it enhances the access. And at the same time, there's a lot more data that is coming out through handling these means as compared to offline traditional means. And so why waste that data? So over time, what we want to see is also that the whole practice goes towards generation of more data, patient data, behavioral data, and then to be able to then use this data to create insights, and then through these insights to be better able to diagnose or predict or treat, right? So this is really a long play, really, because it's really, in the very early stage of developments, I feel. Yeah, thanks.
Thank you so much for that. It's fascinating. And as working for a company specialized in digital health, I like the fact that you are a supporter of its development. So thank you for that. Let's go back to the startups. Okay, you are both tackling mental health in different ways. The audience would like to know, what are your ventures doing to tackle indeed mental health? Let's start with Antoinette first.
Okay, sure. So for Safe Space, same as Joan, we were around before COVID. So we really saw the pure decline in global mental health, not just on a Singapore level. And we were really there at the right place at the right time. So we've developed a strategy that has worked for us tremendously well. Firstly is to improve mental health literacy. When people understand the signs, the triggers, and when it's okay to start seeking for help professionally, that's when the adoption is easy. And through this, word of mouth referrals came because they understood the value that we brought to them. They trusted us as a company. And that's when we actually saw a lot more corporate clients approach us via word of mouth referrals saying that, hey, we've tried your service. We want to roll this out to our entire company. So I can give you some statistics. The whole of 2020, we had about 2 corporate clients. At Safe Space now, we have 35 corporate clients spanning across Asia, India, Australia, Africa, Dubai. So our growth has been exponential, and we have found a strategy that works well for us.
That's amazing. Congrats for that. Can you add a bit more on, let's say, the challenges or factors that have helped the adoption of the solutions that you offer?
So in terms of challenges that's being faced by both consumers and corporate clients within this part of the region, access is the number one issue. Access to a trusted partner that was actually catered for local but was able to scale globally. So that was the primary concern. A lot of them had global EAP providers, but they didn't understand the local cultural context that was being faced in different regional offices in this part of the world. So that's the value that we brought. We really were very strict with the supply of therapists that we brought on board. Quality for us is the number one key factor in our hiring process. We only take on masters or PhD holders from our therapists to really build up that supply pool and to ensure that local languages are available so that they can share their concerns comfortably in their own native language. So we have 7 different languages at Safe Space. It's English, Mandarin, Malay, Tamil, Bengali, Hindi, and Japanese. And increasingly now Thai and Tagalog has been added this month as well. So giving them ease of access, the comfort and the trust to use the service in the comfort of their own homes, where they're not going to be judged by HR. That's the number one question that comes true when we do our onboarding. How is HR using my data? So we actually show them, how does a HR dashboard look like? We show them that their privacy is always protected. We walk them through the privacy policy at Safe Space as well. And once we build that trust, that's when adoption is easy.
Amazing, thank you for that. And we're going to explore the employees part in a second. Same question for you, Joan. Okay.
I think when it comes to what we do and who we usually work with, I would put it into 3 buckets. One would be on the employer side, 2 will be on the insurer broker side, and then 3 will be on the pharma side. We have a B2C presence, but it's mostly organic. So we don't do any significant paid marketing or anything there. or actually across any of the channels. And I think how we work with them necessarily varies from channel to channel. But when it comes down to it, I think providing access, providing literacy, and all of that, I think that's the bread and butter for any mental health or any healthcare company. Whether you are mental health or not, that is the basic of what you need to do, which is to provide access to the professional and to make sure that they know what they're accessing. But really, I think on top of that, what we're layering on is actually providing longitudinal, insights-driven type of care delivery. And so when we say end-to-end care, we really mean, preventive all the way to curative and back again. Because any one individual is always going to be dynamic, and any one organization above, the individual is also going to be dynamic. And so to get that kind of real-time insights, that's where I think the tech-enabled one comes in a lot. So how we work with, I'll just take an example here, employers, right? Because I think that's probably the majority of the bucket here. Apart from just providing, digital-driven mental health care, I think it is very important to understand that it's app-based, but also non-app-based at the same time. You can't just empower them with a resource. You also need to activate them on the ground. And I think the better we understand the company scenario, the better we are able to, drive adoption and also get utilization rates up. But we don't just stop there, right? Because again, when we're looking at longitudinal, insights-driven type of care, we're also talking about clinical outcomes. We base everything on scales for depression, anxiety, and stress. That's something we've done even in our POC on pen and paper, quite literally. And we do it now on the app as well. We've just digitized the whole thing so we can slice and dice the outcomes better. But it's something that our in-house clinical team is tracking all the time, right? And so I would say very simply, for the end user, whether you're an employee, whether you're a student, whether you're a man on the street, it doesn't matter. We want you to have destigmatized, discrete kind of access to mental health care end to end, regardless of where you are on your journey. You could be more preventive today. 3 months later, if you're going through a divorce, it could be somewhere, closer to, psychotherapy that you need, that's more intense. But as you come out of it, you might get back to more preventive care. And regardless of where you are on that journey, we're going to be there to longitudinally, ongoingly help you. And I think when it comes to the employer level, the insights-driven bit is very important. Everything we do is data-driven, hence all the data scientists we are slowly hiring now. If you guys know anyone, please refer. We are hiring, definitely. But I think that's where for insurers, for pharmas, as well as for employers, at the end of the day, what's my ROI on this investment? And that ROI is really determined not just based on utilization, because that can always be manipulated, that can always be, coming in ebbs and flows, but also, are people actually getting better? Are they coming in and walking out happier? Or are they, feeling supported ongoingly with thoughtful chat? And so I think those are the kind of insights that we do provide. They are customized to the client, and they are also, in real time, right? Or at least as real time as it can get in this current phase. And so I think that's probably how we work with the different channels and stakeholders.
Thank you for that. And again, if someone is looking for a job, you already know, you know who to write to. Step back and let's dig a bit deeper on each of the offerings for employees. As again, we are at Novartis offices, and I would like to know a bit more on your specialty offering for corporates before we move to the insurer. So let's offering for corporates.
Okay. So for us at Safe Space, every company was affected by COVID. But the thing is, everyone now realizes that they do need to provide some kind of mental health benefit to also retain their existing employees. So what we have done differently is that we have created bespoke programs for all corporates. No matter what your budget is, no matter what your goal is, we will deliver something that's catered for you. Whether do you want education and education only, because not all your employees need therapy just yet. If you want a mixture of both corporate education as well as access to therapy sessions, but it's really the insights piece that is what the corporates want. So Joan mentioned that, making sure that the employees are actually getting better when they use the service. So we do provide a quarterly impact measurement analysis to prove that people are getting better when they use our platform. And to what extent are they getting better, and would they also recommend Safe Space to someone else? So for us, on average, our net promoter score is 76%, which is great. We're so happy to hear that. For the balance, we've indicated that it was a no. It was because they're still very early in their mental wellness journey. They can't really give a comment at this point in time, which is fine. 76% is amazing. So we're very happy about that. And we do a lot of customized programs, whether it's for corporates, but that's just the corporate side of it. We do work with hospitals, insurers, as well as schools. So on the hospital front is really aftercare support. The hospitals are crowded, right? How can we support the hospitals where if it's a non-emergency care, can we support them as your partner to carry on the aftercare support for the caregivers, for all the other providers that are within the hospital ecosystem? With insurers, and I know there's one next to me, a lot of them have not created a mental health policy yet. Let's just be very upfront about this. I believe, many of them, including the one here, is already doing a lot in this space, which is amazing. But there's not many people who are aware of the policies as well. So how can we work with them, provide the research as well, to co-create a mental health policy together? So we are actually working on this from the ground up with an insurance provider. I can't name names, but we are very excited to be working together with them in this space. When it comes to the schools, the teachers, are also affected. So how can we support the teachers, not just the students? Can we provide innovative ways for the youth to be directly involved in being the solution for mental health? So I mentioned that part of our vision is to drive innovation. How can we do that through gamification? How can we do that through a mindful hackathon that we actually sponsored? Yeah, so we sponsored a student-run hackathon called Mindful Hacks for the youth to be directly involved in the solution for mental health. So we're doing a lot of things in the space when it comes to corporates, schools, hospitals, and insurers, and all of it needs to be working together at Safe Space to really drive the outcomes that we want to see.
Amazing, super interesting. Joan, anything to add?
No, I would really love to hear from the insurer representative that is sitting right next to me.
You are harassing.
We're not harassing. This is all words of encouragement. But no, I'm not going to sit here and, tell you why we're different. If you want to know, reach out, drop me an email. My name is joan.low@thoughtful.world. Drop me an email. I'm super open. Find me on LinkedIn. And we'll be able to have that conversation in private so that I can truly customize it for you. There you go.
Okay, thank you both. That's amazing. Okay, Priyanka, now it's your turn. So you lead the development of the value proposition for health transformation in Access Singapore. Please tell us what's the mission of your team and how you are engaged in transforming healthcare.
Sure. Before I jump on the mission, let me take a moment to talk about the transformation that we have been undergoing. So Access Singapore has embarked on this transformation journey a couple of years back when we did a market survey. We did a survey with the corporates, with the workforce, with the brokers, all different parties. And what some of the key insights that we learned from them was, one, the workforce in Singapore is quite diverse. People are coming from different backgrounds, different age group, and had different needs. So the offer needs to be very customizable and flexible. And second key learning for us was all of these services people want to access through in a seamless manner through digital platforms, because people are now used to access all these services through mobile phones and apps. So these were some of the key learning for us. And based on that, last year, we launched our new corporate offer called Better Me. It's a group employee benefit package. And that goes beyond the traditional coverages, and it actually offers a wide range of health and wellness services. So my team's mission, my team is a strategic function at AXA Singapore, and my team's mission is to further strengthen the proposition of this offer, and we are keep on expanding the services, health and wellness services to this offer. And second key focus area is to enable and ensure the best customer journey for our customers through these digital platforms. So these are the two key focus areas for us.
Fantastic. Thank you for that. Can you please share a bit more in terms of AXA's strategy in leveraging digital health with specific focus on mental health?
Sure.
Before these two ask you the same question. And of course, it's a strategy question. Feel free to talk on behalf of the insurance companies.
Sure. I'm already feeling the burden of No worries. Okay. So as a leader in global health insurer, AXA's strategy is quite key. The health is quite key to AXA's strategy. And especially after pandemic, it has become one of the key priority for sure. We have been we have been making consistent efforts towards our strategy of moving from payers to partners. So we embarked globally on this strategy of moving from payers to partner, getting closer to the customer, serving them better, to enable affordable healthcare solutions through these digital platforms. If I talk globally, you might be aware, basically recently AXA has collaborated with Microsoft to launch a new digital platform for the healthcare solutions, and we are building a new ecosystem for the healthcare. And this is to basically, we realize that the healthcare ecosystem is quite fragmented right now. So the objective for us is to integrate all these services and provide a simplified solution, personalized solution to the end customer. Now, if I focus on AXA Singapore in particular, especially on the mental wellness, we have taken up, I would say, multi-pronged approach. So as you were mentioning earlier, yes, probably we don't have a separate policy, but we are working to enhance our products to cover the needs on mental health. In addition, as I mentioned, we are offering services on mental wellness through one of our innovative partners, which is actually providing a holistic offer to our corporate employees. Why I say holistic? Because it starts from the awareness program. So when somebody takes on the Better Me offer, they first goes for this awareness program. We do awareness events and sessions on the mental wellness. And then after, they are encouraged to take a self-assessment. Based on that, then we see that, okay, how is your workforce performing in terms of anxiety, depression, how is their scored? And then based on that, we are providing a risk-based intervention. So if you are low risk, then you might not need a 4 months program or something. So based on what this different risk level are, we are providing a customized offer through the app again, which then basically solve their or provide professional coaches depending upon the need. So this is the approach we are taking. In addition, we are also doing public webinars and events. In fact, very next week on 25th of October, we are organizing a mental wellness event, which is open to all our intermediaries, clients, customers, as well as to public.
So fascinating. Yeah, the risk-based approach, I like it. It would be interesting to undergo through that and see my score. Jokes aside, again, staying a bit on just the mental health portion, and of course, as we mentioned at the beginning of opening the panel, affordability and accessibility of mental health solutions, it's an issue. What is an insurance company as AXA doing in terms of evolving these coverage policies, and how is that being tailored to corporates, to employers, for, again, broader wellness program?
Sure. So again, to this, I would say before jumping on the cost, I think we need to understand the driving factors for the high cost of mental wellness, which is, I believe, is driven by lack of awareness and limited resources and people who are really trained enough to meet the mental wellness needs for the customers. So we have to tackle these basic problems, and which would only be probably solvable through digital and technology, which I believe a lot of companies like they are doing and working on. From an insurance perspective, also, as you mentioned, so far it has been quite traditional approach. So now the approach is also changing. And for insurance companies like AXA, we are supporting this ecosystem through these partnerships. So what we have done is through these partnerships, we have managed to bring down the cost lot subsidized for our customers. So when a corporate goes and take on these kind of offers separately, versus when it is offered as part of BetterMe, they get it at a highly subsidized rates. So that's the role that we are playing on. We are also helping to ensure that the customer is able to access all these services on the wellness through our integrated app. So for a customer, the way we see, we are providing the wellness services end to end. From our strategy is to provide health and wellness services to support our customer at every stage of their health care journey. So there is a prevention, there is teleconsultation, and then there is post-hospitalization. So for customer, they should not need to go, different app and different ecosystems for all these different services. So what the role we are playing is we are integrating all these services in one single digital platform, so that for our customers, for the workforce, for the employees, it's much easier to access all these services at a much affordable rate. So this is what we are doing.
Thank you for that. No, it's super clear. I would like to hear their opinion now. This is Are you okay with the answer, by the way?
Yeah, okay.
Are you okay with the answer?
We can follow up.
Sure. Happy to answer.
Staying on the affordability topic, how are your individual ventures helping with this issue? I'm basically asking a bit of a ticket size of accessing your offerings.
I can tackle that first. So let's take a look at insurance first. Since we just came from that topic, we are doing our best to see how we can support various insurance providers and even our therapists to have their counseling sessions claimable via insurance policies. The number one barrier that we keep getting is that the claims process is quite strict. It must be through a GP or a doctor, and to some extent, medication as well needs to be provided. That's the feedback we've been getting. And that's also seen via something called the CHESS card, for example, in Singapore, where there needs to be a prescription. However, my question back to this would be, what if the therapist is clinical? So it is a clinical assessment, but prescription medicine is not needed. Why can't it be claimed then via insurance, Can we change the process a little bit? So that's how we're trying to change things differently on the insurance side. How we're doing it for corporates, for example, to make it more affordable is we will straight up ask them, what's your budget? For your budget, what are you looking for? And what are your goals that you want to achieve for the next 12 months, 24 months? Based on that, we will actually create a customized plan. Most of them are really appreciative, actually, because they want to provide it. It's just that due to COVID, their business was impacted, cash flow is impacted, but they know they need to provide something. So that's actually how we started. And based on that, giving them that flexibility, we have been seeing multiple top-ups, every 3 months, actually, for some corporate clients, that the initial package that they have signed up for is fully utilized in 3 months. So yes, our utilization is high, but it also has a double-edged sword where your employees are impacted. They do need the support. This is foundational work that we can use together with them, the data that we're collecting to plan for the next year ahead, where do you want to replace your existing EAP program provider with SafeSpace, for example? So we will work together closely with them on that front, providing them with a very affordable pilot according to what their budget is right now. And on the consumer side, we actually do work with a lot of our therapists to provide discounts. So if you go to our website at safespace.co, you will see there are multiple discounts offered by the therapists. We are more than happy to support in terms of offering discounts for our consumer base, whether you're a student, you're someone who got retrenched, or you're looking for career guidance in different areas of your life, or especially couples. Couples have recently been the number one, or rather top 3 issue in Singapore lately. We're not sure what's happening on the relationship front, but a lot is happening there. So if you want to read more about that, just take a look at our research, our Q3 impact measurement research. We don't know what's happening on that front, but we're offering discounts in that space. So we're doing quite a bit there to see how we can make it more affordable. Yeah.
Thank you for that. Same question for you, John.
There was a reason why I brought up divorce as an example. It wasn't plucked out of thin air. The data speaks for itself, and I'll just leave it at that. I think when it comes to affordability, I think that's for Thoughtful, that's always been at the forefront. But I will caveat that to say that no one startup can solve this issue. It's an ecosystem issue. And it's much more complex when it comes to healthcare, where you have stakeholders that are not just in the private sector, it's private plus public as well. And so I think it will be a collective effort over time. But for us, I think our model has always been, a daily bite-sized coaching first. Not everyone, for example, needs full-on therapy. Not everyone even needs coaching all the time, which is why that end-to-end care is always there. We will triage accordingly. And I think, for example, just to give you a very quick flavor, right? For our consumer side of things, it's easier because, that's kind of fixed into the app already. For the price of a 1-hour counseling session, you get full access for a full month, one-on-one to your certified mental health professional. Text anytime, anywhere, and they'll check in within 24 hours asynchronously. If, let's say, like me, I'm always super busy as a founder. I'm running around like a headless chicken sometimes. And I forget to text my coach, no worries. They'll check in anyway, Monday to Friday, on a daily basis. So I think it's using digital to scale. And with scale, you have economies of scale, which can help, bring down the cost and increase higher touch points. But I think at the end of the day, this is, whether it's Thoughtful, whether it's, Safe Space, or whether it's any other startup in the ecosystem, we cannot change the entire game because it's very entrenched. Insurers play a very big role there. Insurers play a very big role, the payers of healthcare. And to be fair, Priyanka, it's not just insurers, it is the entire ecosystem who pays for healthcare. The governments, it's the insurers, but it's also to a certain extent how at the individual level, do we view this as a discretionary spending or a non-discretionary spending? In places like the US, mental health care, therapy, all of that is under their discretionary spending. That's something that they're non-discretionary, meaning to say that it's not a choice. It's just part of life, and it's an essential that they spend on. Out here in Asia, I think it's still very much an optionality. We see this changing over time. And so I think hopefully as the ecosystem matures, we're still at the very early stages, but over time it will mature as we gather more data, as we gather more insights into what care delivery looks like, what readmittance rates look like, and what necessity or risk levels are, then I think, we'll have more meaningful coverage on all fronts, whether it's government, private sector, or otherwise. I'll leave insurance out of this right now. Yeah.
Thank you for that. I would say that very exhausting and satisfying answers from both of you in terms of need on the topic and on the solutions. I would like to turn the lights on Wai Chiu and talk a bit on the ecosystem in broader terms. As an investor, of course, I would first of all ask you, where do you see the sector moving forward in terms of solutions, valuations, et cetera, et cetera?
Right. Yeah, I should first off, express my empathies with Priyanka. There's a reason why, I was first to all these seats and I didn't take the center seat and I did sit between the startups, right? So good luck to you. You experience firsthand how it's like. But jokes aside, right? I think Priyanka and who she represents does play a critical role. But that's not the only payer, right? The government, our pocket, individual payers, they're all payers. And I like the way Priyanka described, from payers to partners, right? So it sort of shift the burden a bit to a mindset of partnership rather than being seen as somebody with a pocket full of cash, right? But from an investor standpoint, it's also an indirect payer sometimes. We pay in order to see a transformative business model in process or product creation come to fruition, right? But we have to see that pathway, right? So it has to be transformative. It will be a big quantum leap to the status quo. It has to be sustainable, right? And that's what we are investing towards the future and the kind of transformation that we can create in years to come. And we can be patient, right? But we can be helpful and so on and so forth. But what is important is to have a perspective how the ecosystem indeed must evolve together. Right, it is almost a cliche, but it's very factual that if all the ecosystem players are not coordinated, then the risk of investment failures are actually quite high, right? Sometimes it doesn't mean that the business will fail, it doesn't go anywhere, right, for investors to exit. Then that itself is a problem for the investment case in the first place, right? So that's why, for us, when we make investment cases, we also got to see how the payer position and stance are coming up in the maturity of that, prospect. There's such a thing as investing too early, right? So we need to have a sense of timing, a judgment on that. And from the startup side, we need to look for whether the startups, in terms of the proposed solution, are transformative. Really the incrementality must be high, right? Additionality to the impact and the commercial viability in time to come. So it's almost like we hope we have a crystal ball, but we don't. So we can only look at the trends and the directions, and then pray that our sense of timing is spot on. Yeah. So that's how we, that's what keeps me very anxious and depressed sometimes, and that's where I become a user, of Safe. Yeah. Thanks for the discount. Yeah, you apply to my whole team as well. Thank you.
Thank you, Waichu. Just one more question on the same topic, which is a bit more customized, as we have two founders here. What do you look for in a mental health venture? What are some of your investment criteria?
Well, we look for passionate founders like Joan and Antoinette. Yeah, so that's very straightforward. I think the team is it's not everything, but it does matter a lot because we bet on people, and plans do pivot and evolve because market is never static. But we do look at the founding teams, right? And of course the timing and the proposition, right? What exactly, the 5 Ps, including process. Yeah. So, it's just seeing how these things evolve and really is finding that fit. Right. And really, when you see the fit, it's like a sparkle, right? It's like suddenly the lights turn on and you feel a lot of conviction that, okay, this investment is going to make sense. Right? It may not succeed always, but it gives you that conviction to put money at risk, right? So I think that's where, a combination of such factors that I described just now would be highly relevant in us making that case. So for mental health, to be frank, with the pandemic, right, it does shift the ecosystem and impact all the different players to a more coordinated stance than it otherwise would, right? So as we see in many other investments like education, ed tech, health tech, digital health, telehealth, and things like that, the adoption, right, is hastened, right? The underlying trends are always there, but the hastening of the adoption actually make us accelerate our investments into those spaces as well. So likewise, for all the factors that I mentioned just now, the pandemic has shifted the collective consciousness towards finding a solutions together. Now that does not mean, right, that all the players are moving as fast. I'm sorry to say, certain players are a bit more traditional and conservative. They do have a lot of in-house process to manage. Startups move the fastest, right, and most dynamic. But then, my favorite analogy when we talk about, investments through ecosystem approach is you get 4 people at the 4 ends of a table. You have no point that 3 people are working very hard to lift their end, and then there's one who is still hesitating, right? And then you mix the table wouldn't move that much, or the others have to do a lot more job to balance things and move forward, right? So I think, assessing this kind of dynamics for us as investors is extremely critical.
Thank you for that. Really a full answer on also the challenges that you are facing, but really thank you for that. I have just one last question that is more on the soft side of it. I would like to open the questions from the audience. And one of the first ones is on about you two. How can an individual have access to the app?
You can go to safespace.co. The access is free. You can just sign up. You can log in. You can check out our resource portal. It's absolutely free. We have very affordable counseling sessions. They start off at $30, ridiculously cheap. But we are very carefully curating because we are working with multiple counseling universities across the region where they send their counseling interns to us as the practicum site. So you have access to a wide base of counselors at Safe Space, and you can have access to that for free.
I think for Thoughtful, it's a little bit different. So the app is already there, so it's free to download. Just if you're using Android, if you're using Apple, you can download on both your Google Play Store as well as your Apple App Store. It's free to download. There's a whole bunch of self-driven tools, monitoring tools, emotional trackers, thought journals, clinical assessments. They're all there for you to use. We also have curated lesson packs that cover a wide range of mental well-being and mental health type of topics. It's all done by our in-house clinical team. That's also made available to everyone. And if you want to engage with a coach, our algorithms will find the best fit one for you. So yeah, go explore, have fun, and have a thoughtful chat.
Thank you both. Question for Priyanka. How can mental health partners work with AXA? Specifically, is there any preference on technology areas?
So, as I was mentioning earlier, we are open to partnership with the new technology startups who are working in this space. So obviously we have an open channels to approach us for these partnerships, but the couple of things that we do look at is both from what services it will bring to our customers and whether it will be possible through these digital integrations or not. While I was listening to both of them, I realized something, that still insurance companies are being perceived as payers only. So I want to change this a bit because you see them as a partner, because, for example, one change that we are bringing in with these partnerships is also making these mental wellness services accessible to the workforce. Because today, if you see, first of all, people don't realize that they need it. It comes at a very later stage. And when they go to there, then they need, we need insurance companies to pay for these services. But we have changed the approach. What we are doing is we are working more in the prevention space, being a partner. So when we make it accessible to the entire workforce for a company, now it is an individual, it is on their app. So if they are not feeling, if they want to, have just a hotline chat to somebody, they can do that. So when you work at the prevention step itself, when you work at that stage itself, you anyways are reducing the cost because you are not letting those people to go to that extreme level. So I'm just trying to say that maybe it's not very straightforward to just, pair. We are approaching this problem of cost in different ways.
And of course, AXA has also employees itself, right?
Oh, yeah, we are doing for our employees also.
Who suffer from the same problems that everyone else of us is suffering. So,
yeah, for sure.
Thank you for that. One more. Okay, thanks. One for Antoinette. At the beginning, you mentioned 5 areas of issues with... Okay. You said stigma, affordability, accessibility. What were the others?
So it was stigma and self-stigma, a lack of a centralized system, affordability, the use. So use was a separate call out because of the public system gap in that area. And the last one, if I'm not wrong, was, I forgot. If I'm not wrong, it was no lack of access. Lack of access because the wait times were very long. Yes, it was the wait times. So to give you a sense, if you want to see a psychiatrist or a psychologist, primarily these two, the wait time is about 28 days. So by the time you actually see your psychiatrist or your psychologist, you probably got over that situation already, but it's now probably still a lingering effect, you know? So the wait times are very long. So can we find a way to improve that? So those are the 5 areas in the gap in the public system.
Thank you for that.
Thank you for listening, by the way. Thank you for asking that question.
I thought you wanted to blame again the insurance companies. We have another question, again for the startups. Hi, Fong Ming, by the way, from Heritage Capital. Counseling is commonly seen as a high-touch, unscalable activity. Good therapists are hard to come by, and demand clearly outstrips supply. How do you plan to overcome these problems with your tech solutions? Startups. From an investor, by the way.
So you're right. You know, demand definitely is starting to outstrip supply. What SafeSpace is doing differently is that we are directly involved in the education of the next generation of counselors and therapists out there. So we have partnered up with Kaplan, we've partnered up with School of Positive Psychology, ECTA. We are actually training the next batch of counselors to be part of the solution for high quality counseling. You know, giving them direct access. What is it like to work in a mental health tech startup? Because we're all moving towards digital care, virtual care. How does that look like? How can you manage your clinic or your practice in an online environment? So we provide the training itself. And our goal is to really be able to scale that, not just in Singapore, but regionally. So working with all the various associations in each market that we are in to see how are you currently training your existing pool of therapists? Who is the next generation? Can we bring them on board to provide them with practicum and to get them involved in the solution? So that's how we are training up the quality of supply.
Thank you for that. Joan, do you want to add anything? Sure. And we have one last question.
Okay. For Thoughtful, I think, thank you for that question, that scalability question. We do see that a lot. I think at the end of the day, if our solution hinges on the scalability of human beings, then the scalability in and of itself is limited. And so really a couple of things here, right? Apart from just scaling the supply side of care providers, and you know, I think SafeSpace does a very good job with the training for the next generation and all of that very important work. I think the other thing is also to realize that they're highly inefficient right now. So even though there is more demand than there is supply, the fact of the matter is the current supply is actually not optimized. There are people who are not working at the capacities that they could, or if they are, a lot of it is actually work that shouldn't be done by human beings anymore. And so I think this is where, on one side of the equation, what I call building the plumbing and the infrastructure for the mental health ecosystem, Thoughtful plays in, right? And that's Thoughtful Chat Pro. It's an app that's also, you'll find it on the App Store, but you are not qualified to sign up. I'm so sorry, unless you have passed our vetting. But essentially, that's actually a one-stop platform for people to build a more scalable practice. Because at the end of the day, the truth of the matter is 95% of care delivery in mental health happens outside of the hospital setting. It's very different to other therapeutic areas. Cancer, diabetes, stroke, the only place that you will go for treatment will be in the clinical setting, in the hospital or in the clinics. Mental health care is quite the opposite. Predominantly, the care delivery happens outside. But what happens outside is that it's fragmented. It's not part of the four, Sing Health or 4 groups. It is highly fragmented. It's not digitized and it's not scalable. And so we're trying to solve all those problems on one side of the supply side. At the end of the day as well, insofar as this allows us to also realize how we can provide care, better triage this care with or without that kind of human intervention. I think that's where the long-term play of Thoughtful comes in, hence longitudinal, insights-driven type of mental health care delivery.
Thank you for that. One last question very quickly. We are beyond time, 5:03 for Waichu from Sharik. Thank you, Sharik. You mentioned impact investing. Would the due diligence done for such health startups have a different threshold in terms of traction, growth, and valuation?
Oh yeah, it's a good question. Actually, even on the impact investing landscape, there are different kinds of impact funds. There are the impact first funds, for example, that actually looks at maximizing impact and deprioritizing financial returns. For Heritas, we are not, our current funds are not impact first funds. We are what we call collinear, funds, where we both target the growth, the returns, as well as the impact, right? So from that standpoint, our due diligence on the startups investments exactly what a traditional fund may do. But on top of that, what we want to see is that both impact and business goals are collinear to one another, such that when the business grows, the impact actually scales as well, right? So we are looking for that kind of very positive virtuous cycle dynamic, right? So that we achieve both at the same time. Yeah. So therefore, in terms of due diligence, is as comprehensive as any non-impact commercial fund do. But we do have more extended, in-depth conversation with founders, right? To say, hey, what else can we achieve beyond the traditional profit metrics, the growth metrics? What can we do slightly differently? And when you open your mind to that, you see other possibilities, right? We have seen impact investment models where you could provide free treatment to certain users who are disadvantaged, not privileged, right, underserved. At the same time, today's social consciousness is such that there could be CSR or foundation money paying for that, right? So you diversify your revenues from a traditional user-paid kind of solutions to other non-traditional source of funding. And that itself can also make a very viable business model, right? So we are just looking at all these different emergent business models in addition to the traditional funding and business model. Yeah. Okay.
Yeah, of course. Okay. Thank you so much. I think Sharik is happy with the answer. No, thank you for that. Yes, please.
So just to add on to that comment on investment, so just a point, just a plug, in all honesty, a shameless plug, that for Safe Space we are going to be raising our next round, and that's happening in Q4. So if anyone's listening and you're interested, please reach out. But yeah, it's a shameless plug. I took the opportunity.
No. Well done. No, well done. Okay, I had promised. Yeah, you already did at the beginning. Thank you for that. I promised at the beginning that the last question is going to be, what do you do to feel good? Quick round.
Well, generally, reflection, right? Okay. So I think it's important we have a mindful culture in Heritas, and we pause to think and reflect, right, rather than rush to get things done. So it's very important to sort of take stock of things. And one of my favorite mentoring points to my younger colleagues sometimes is that in order to run fast, you got to learn to slow down, right? And be clear-headed what you are doing.
Thank you.
Okay, so on a personal level, what I do to feel good is honestly to go to the gym and to box it all out. Yeah, box all the frustrations out. It feels great. I thoroughly enjoy dancing. I don't need alcohol to dance, but I can't do that anymore. So my next best thing is to go for spin classes where the atmosphere is still the same. I can still kind of dance on a bike. But on a corporate level, we have allocated mandatory mental health days. My whole team must go on leave. I don't want to see them in the office. We do meditation every Monday in the mornings together, like just for 10 minutes. I don't think we can last that long. But, we have started all these initiatives because we also have to walk the talk. Yeah, so that's what we do.
Thank you so much.
For me personally, if I have to just burn out, I just spend time with my kids. It just takes me in another planet and I forget all about work. And the other thing is I go for cycling. So these two are good enough for me. Just take the stress out.
Thank you.
Thank you.
I think for me, I'm like an energy bunny, so a bit similar to Antoinette, and maybe it's a founder characteristic. Too much energy for our own good, right? So we need to burn some of that off sometimes. So definitely physical pursuits. I particularly like water sports, whether it's like rowing or swimming. I do swim every day, or wakeboarding, something along those lines in the water. But of course, at the end of the day, we all need to walk the walk. I myself go for therapy and coaching. And so, talking to my thoughtful chat coach definitely helps a lot with my happiness. And sometimes it's not so much about the therapy, it's about having a sounding board that's objective, having someone to reflect back some of the things that's going on right within our headspace, and helping us to kind of dissect that and break that down into, what does it mean for us? Is this something we keep? Is this something we process? Is this something we discard? And I think sometimes we're too much in our own heads to do that objectively. And so I like to be quite proactive about it, and definitely everyone on the team's on Thoughtful Chat. So there you go. We're always, first and foremost, our own users.
Thank you for that. Let me share also a bit what the audience has been sharing in terms of what do they do to feel good. We have, of course, yoga and meditation as the top ranking activity. We have cooking and swimming, regular jogs, cycling around Singapore, a walk in the nature and green spaces. And we have quite a full answer from Chadi. He does exercises in the morning, a nice dessert in the afternoon, and a glass of wine at night. Okay, thank you for the completion. And of course, spending time with loved ones. Golfing. I need to try golfing. Okay, this is all. Chris, what do you do to feel good? Okay, he plays guitar, man. Thank you. I mean, this is all we had prepared today. Thank you, first and foremost, to my panelists. Amazing conversation. I personally enjoyed it, and I'm sure also the audience has had a good impact. Thank you so much. Take care. Thank you to the audience, and of course, we're gonna meet again soon in the next records in November. Thank you so much for joining today.
Thank you, Anna, for moderating. Yes. Thank you, Galen Growth, and thank you, Novartis.
Fantastic.
Yes.
Thanks.